All right, everybody, welcome back to the Barbell Therapy Podcast. I'm your host, Dr. Brett Scott. With me here today is Dr. Edgar Belanis and Christina Knight, a nurse practitioner. These guys own Dynamic Evolutions in, is it Norwood, Mass?
Yes, Norwood, Massachusetts.
So Norwood, Massachusetts. And I've had the opportunity to go down there and see their practice and all the different things they do. And they run a practice or clinic that's quite different than anything I've ever seen in the health and wellness field. Of these guys are doing all kinds of things with PRP, stem cells, some aesthetic things. What are all the services you guys offer? Because there's a lot on there that you guys do.
Well, we can start with what you mentioned and go over that real briefly. I mean, platelet-rich plasma is a PRP, and it's sort of a component, if you will, of stem cells in of itself. It's actually taken from one's body. It's within the blood that we have. And the younger we are, the more we can gather as far as what's called mesenchymal stem cells. And the power of that is that it has healing powers, and it restores damaged tissue. So by gathering it from one's blood and then you process it, we can use that material and inject in areas that are injured. For instance, soft tissue is a common site, tendons, muscle. Another common site is joints. And we see a lot of individuals for either shoulder issues, knees, hips, so just about any joint in the body for that matter. When we feel that it needs to be taken up to a higher level or higher degree, and that's where we talk about what's referred to as processed stem cells that are taken from umbilical cord right at birth. I'll let Christina elaborate on that, and she can talk about the stem cells from the umbilical cord.
Well, the company that we use, actually even the UFC uses, we have injected several UFC fighters. We have looked into the company prior to using this company back even during the pandemic. We were using stem cells. We were going into people's homes. They didn't want to go into the hospital. They wanted to avoid going towards the ventilator, the whole thing that was happening back there. And we had some good results, but what we've come to find out, they weren't as good quality as the stem cells, as the company that we're utilizing now. So what happened, they're not diluted, and that's why we worry about going, when our patients say they go out of the country, we don't know what they're actually getting. They could be getting great stuff, but then again, there's no regulations there. So even though we have the FDA, I think the FDA is good to a point. We can have an argument about what's good, what they accept, what they want to accept, etc. But right now we have a platform that at least it's baseline that we can look for quality, quantity, etc. So what this lab called VD Labs, what they do is when they extract stem cells from the umbilical cord, and this is all donated. There's no aborted fetal.
Christina, could you just pull your hair back or move your mic a little bit, because your hair keeps hitting
sorry.
on the mic?
Okay. You can't hear me. I'm sorry.
Yeah, it just keeps brushing up against it.
Oh,
yeah. If you just,
is this better?
Yeah, your hair was just stuck on it, and it kept making noise.
Oh.
Your hair on that side.
Yeah, there you go. That's better.
Okay. So going back to this, these are as pure as possible and very potent. And we have looked at all the data. They screen every woman, and it's they only have women between 18 and 22. So the younger you are, the better quality of the embryo and the baby will be born. And they are followed throughout pregnancy. And like I said, every disease is screened. And then it's also cesarean section babies. So there's no potential for any kind of infection. We're very pleased. We've been doing this for a while. Several years now. And we have finally found what we feel is the best company out there with the best results. I think stem cells they'll work. It just depends on how much you need and how much you're going to pay for if it's not the pure thing.
Yeah. So that's kind of go ahead.
Yeah, I was just going to add on that. It's been a growth learning curve, if you will, with regards to the product. I mean, initially, like Christina mentioned, it was useful, but as time goes on, companies want to say that they have the better, obviously, stem cell and so forth, which is good. I mean, competition is always a good thing, and I think in this particular case, it increased the quality and the performance, of the stem cells, and that's what gives you, the results that you're looking for. And in the past, where, for instance, stem cells, when I mentioned, could be used for soft tissue, joints, and so forth. Now you can place it into a catheter and put it in a vein intravenously, just like you can do IV vitamins. Everyone's familiar with IV vitamins. Now there's IV stem cells. Okay, that's in and of itself quite beneficial. Because it'll gravitate. They're like scavengers. They go and look for areas of inflammation. All right. So if the inflammation happens to be, let's say, in the gastrointestinal system, the gut, it'll go there. Or if there's an inflammatory condition, say in the lungs, it'll go there. If it's so it's widespread, and they've even taken a step further, where in the past, you had to have a specific, a small factor of the stem cells to penetrate into the spinal cord, into the spinal column, into the brain. And we have what's called a blood-brain barrier, and that's protective in the sense that, we don't want to have bacteria or viruses, entering the spinal cord, the brain. I mean, it does happen. I mean, we've all heard of meningitis and that sort of thing, encephalitis. But thank goodness, for the blood-brain barrier in that it is very protective. And so the companies have produced the stem cells to the point where now they're small enough it can penetrate that blood-brain barrier, right? So if it does that, what is it going to do? It's going to now be a scavenger that it is, look for the inflammatory process in the spinal cord, in the spine itself. And we've had patients that have come to see us, with degenerative issues of the spine. And that's very common. I mean, as we get older and depending on what we do to ourselves, we can have severe to mild degenerative joint disease involving the spine. So it'd be difficult to kind of inject, every little spot of degenerative disease in a big, long spine. However, using this product, will go in widespread areas, of the back. And we've been able to take patients off, pain medications that they had to rely on, which is a problem of itself. We're all aware of the epidemic of use of opiates. And a lot of times it's not the fault of the patient themselves. I mean, they do have a severe disease that requires pain control. But, there's another side with painkillers, that we all hear about, that's a horrible situation to get yourself involved. So all of the things that we talk about, all the things that we try to apply to this practice is a natural format of things. We are fortunate to stay in that category. And like I said, take patients off, things that are crippling them, not just the disease process itself, but the medication itself. I mean, so it's extremely gratifying with regards to being able to do that for clients.
We have quite a few success stories. When Dr. Belanis spoke about the spinal cord, also obviously the brain, when we say blood-brain barrier, we have a patient who's actually going to come in next month for a second round of IV vitamins. This man has been diagnosed, vitamins and the stem cells, yes, yeah. IV. So he's been diagnosed with MS for years.
Multiple sclerosis.
And he was due for his yearly injection this past October. He came to see us in August. He felt he had his symptoms of MS start showing up as he's getting close to his injection. I mean, his IV infusion at, I think he was going to Mass General, and of whatever they use, some biologic agent through the pharmaceutical companies. So we gave it to him, as well as gave him a vitamin pack, and he's still on cloud nine. He can't believe how good he feels. Never had that second infusion through the hospital. And we recommend, when you have chronic diagnosis like that, to do it, and this is what the company recommends, do it twice in 1 year, and then you can do that yearly. So our goal, and most of the people that come see us, I would say 99.9%, want to get off this medication, want to be healthy. We have vitamins, we use peptides. So we look at the whole person. Hormones, we do bioidentical hormones for males and females. So it's not just, hey, let's give you this. Let's look and see. My background is functional medicine, which is personalized medicine, now it's called. So what we look for is what's causing your symptom, not let's give you a medication to, just to pacify you, make you feel okay. And what happens in traditional medicine, you give one medication, gives you a side effect, you take another, and next thing you know, you have fibromyalgia. Fibromyalgia's unknown origin. They have no idea what's wrong with you. They just give you a diagnosis. Mm-hmm. So, again, we look at the person, and that's what functional medicine, again, personalized medicine is. We look at you as a whole. We do a consultation when you come see us. And we want to know what happened to you at childhood. Why, did you have a traumatic birth? Were you breastfed? Did your mom have a C-section? These are all important on how, what's going on in your life. Take stress. Did you have an operation? Are you sleeping? What's your diet like? Are you taking supplements? Are you menopausal for women, or perimenopausal, or even for men? There's andropause. So it's all real. And we just we take away what your body does not like, help you change your lifestyle, and give you what your body needs. Plain and simple. And that's how we used to live years ago. Mm-hmm. Now we're in a different time, I guess.
Yeah. So back to the stem cell stuff. It sounds like there's a lot of nuances to what someone's getting. And so part of what I want to do is figure out if someone's looking at it, because I'm curious about doing it for myself. But what things do I need to look out for? Like you said, so there's bone marrow stem cells, there's mesenchymal stem cells, there's umbilical stem cells. So that's one thing. So where are they being harvested from? And then, how does someone know about the quality of stem cells they're getting and the dosage and everything, and that they're not getting ripped off?
Yeah, no, it's a great question. And if I can sort of say something about that. And those sources that you mentioned, the bone marrow and in the blood. And then there's also, believe it or not, the fat, adipose tissue. Mm-hmm. One's fat can be utilized, processed to stem cells. And we kind of, as we went along this evolution of finding out, what would be the best product, you have to look at, how difficult is it going to be, number one, to process it. How much time is it going to take to process it? For instance, if you look at obtaining stem cells from the bone marrow, number one, you have to be able to make that individual comfortable to put this device, literally, it's kind of like a screw type of device, through the bone into the bone marrow, because that's where the marrow is, right? It's inside the bone itself. So you literally got to almost hand drill through the bone, get the bone marrow. Once you aspirate the bone marrow, then you got to process that. So you can see right then and there, that's pretty well involved, an involved process. Like I said, if anyone's going to drill into my bone, I better make sure that, I'm sedated, I've got good pain medicine on board. I've got somebody who's controlling all that, so it is an involved process. But did it work? 100%. Absolutely. There were clinics here in the United States that people were gravitating to, and they were getting excellent results. But it took also hours for them to go through that entire process that I just explained. And fortunately enough, I think now that we can use the umbilical cord, prior to that, I mentioned the fat tissue. And again, you had to do what's called like a liposuction, where you suction out one's fat. And I had a colleague who actually taught me the process. And again, that's a bit labor intensive as well. And you have to have a proper setting, for the patient to be comfortable also. So fortunately, the companies, like I mentioned earlier, realize the benefit of the stem cells, how powerful it is. And what they want to do is make it so that we'll take the process away from the doctor's office. We'll give them excellent product. And pretty much what you do is you identify your patient, what it is that patient needs to have, because these processed products are somewhat different if you want to inject it into the knee, or if you want to utilize it, through the IV, for, let's say, like I mentioned earlier, something involving the gut or the lungs or the spine. And but it has taken away all that time for processing, which is fantastic. We'll water it, they ship it out overnight, and then when the patient comes in, good to go. You're ready to inject. You're ready to infuse. It's generally an hour process, and it makes things quite beneficial and effective, and patients love it.
I don't know where Christina went, but her mic's still on, so we can hear everything she's doing over there.
Yeah, Christina.
Sorry.
Your mic is interfering.
Oh, okay. I just don't want to confuse. I just noticed the battery is a little low, so I'm like, oh boy.
Oh boy.
It didn't charge last night.
Is it plugged in now?
No, she's getting it.
You lost that light over there, by the way.
I know she did.
When you whisper on a microphone, it's still there.
Oh, I'm sorry.
That's okay. We'll continue on. So as you were saying?
Yeah, I'm kind of, all right. So the question was, what would be the best product for you? I think is one of the questions. And I think I sort of discussed, what we think would be best for you as well. And the things that I mentioned is that, anything we advocate, we haven't done for ourselves, number one, to experience what the process is like. And fortunately, right now, I think the company that Christina that have mentioned already has been top notch, has been absolutely excellent, with the studies that they've done and the success that they've had. And we've seen the success. So, I mean, it's fantastic, whether it takes away an individual's pain with regards to a certain joint, whether it helps, with their spinal cord because of degenerative disease, or like Christina mentioned, if it's some type of a brain or central nervous system disorder, then the product shows to work for that as well also. So I think, the sky's the limit. I think the challenge is, to just continuously follow, how these individuals do for whatever pathology they come see us with. But I don't think we'll turn away anybody, because it is safe. That's the other thing about it. Well, is there something that is of concern that's an adverse effect or something that may be an allergic effect? And to date, I don't think we've experienced that. And the company itself, obviously they have a quality control, sort of center, if you will, and they keep track of anything that could be of an issue, like a reaction. And fortunately, to date, that has not occurred as far as we're aware of.
Yeah. Are there any side effects that come with stem cell treatment besides the possible, infection risk that comes with injecting anything into your body?
Yeah, that was a good point. I mean, I think the infection would become more how the individual has set up for the infusion or for the infection or injection. I mean, for instance, if we do a knee or shoulder, we're prepping that area. We're scrubbing it with an antibacterial, and type of solution, getting it clean, making it sterile, so to speak, the skin area, and using surgical, sterile gloves to do the injections, sterile needles, sterile syringes. I mean, we go through the whole process of making sure, whatever we're putting into someone's body, is going to be controlled. And to date, we personally haven't run into any issues with regards to infections. And I think if there's anyone out there who had a bad experience and it was because of an infection, I think it was the setup, of the injection rather than the stem cells itself. So,
well, I think there's more chance of infection for bone marrow when you're doing procedures like that. We used to do the adipose, we used to do the fat, but that took hours and hours. And you have to actually do liposuction on the patient and then process the fat. There was, like I said, it could have taken up to 5 hours to do that.
But we actually did do that, and
yes, we did do it.
It worked,
and it did work. But
we had to wash it, and the
right.
What was derived from the fat, we had to multiple washes, and then finally get our product. And but when we used it on the patients back then, it did have its value.
Right. This is before we were introduced to the process, and they're processed under sterile conditions. And one of the, you look at the labs, the laboratories where they're processed to, and that's why we're happy with BD Labs, and
great company,
great company, and they follow everything to a T.
So if someone's getting stem cells or looking at treatment, it sounds like umbilical stem cells are the way to go.
I would say so. Yeah.
Yeah. There's three components to it. So there's exosomes that are derived from the stem cells. Those are the ones that will cross the blood-brain barrier and into the spinal cord. And then you have the cord blood. You have the stem cells from the cord blood. And then we have a thicker solution, that we call it. The company that we use is called Hylogel, but it's quote unquote Wharton's jelly. So that cannot go IV. In terms of how much you inject, typically if somebody's very inflamed, for instance, if somebody has lupus or some autoimmune, then we start slow and let the body adjust. So we wouldn't give you a full, most people who come in and have the IV stem cells, we give them, I would say, we give them 2 mLs of the stem cells and then almost 5 mLs of the exosomes. And they can tolerate, like you would tolerate that. I did that a year ago for myself. I tolerated, I don't have any issues. But the people that are very inflamed, we would start with just 1 ml. And then just gradually a month later, give them a little bit more, because the body, there's a lot of inflammation there, and we need to know how they would react. And that's what makes us different, because we do what we do, the medical aspect. Dr. Belanis is a physician, I'm a nurse practitioner, so you're not just going into a clinic and you're not a number. Hey, this is how much you pay for this. Come on in, this is great. We monitor everything, and we make sure, and we look at all the studies, and we even speak to the company if we have any questions, and they're wonderful, they get back to us. So when you come, this is why nobody's had any side effects since we've been doing this. And I mean, it's close to what 2019, 2020 since we've been doing this, because of what brought us into it was the pandemic, actually, and obviously our interest in it. But that's what really pushed us.
I'm actually an example of a COVID infected individual, and that had to be hospitalized because that's how bad things were. But prior to my hospitalization, we just came away from a course on the stem cells, and we were getting all that information and so forth. And so it wasn't yet. I mean, there was one particular place in the country that was utilizing stem cells for badly infected COVID patients, inpatients. And so when I was kind of going in that direction, I was saying, all right, please send me some stem cells. And she was loading me up with the IV versions of the stem cells. This is 2020. And I believe to this very day, because of those infusions, she also loaded me with IV vitamins, high-end ascorbic acid, and zinc and amino acids. I think the combination, of those multiple infusions really turned a corner for me. Because when I was hospitalized, I was being observed. I was on the remdesivir, which I was told right at the start, don't expect this to cure you. It'll be helpful. And that, plus a few days in the hospital being watched, all of a sudden I had this turnaround, and I think that turnaround was because of what was given to me, by Christina prior to me going to the hospital. Finally, it did its thing, it controlled the disease. And it was so ironic, when I was at the hospital, there's a major medical center, by the way, they said, wow, wouldn't you believe it? You responded to that remdesivir. Even though we told you it's not going to cure you, they took they took the cure upon themselves. And even though I told them ahead of time, I said, I know you guys are studying this. I know it's not out there yet, and it's not recommended, but I'm an example of someone coming to you having received several rounds of IV stem cells. And they first looked at me, pretty much all of them looked at me like, oh, this guy's going to be a goner for sure. But I was a survivor. I survived it. I survived that whole, took me a couple of years, and I still, now and then get a little tweak or something or another, whether it's a little brain fog or, a little respiratory stuff. But I don't think if I went that route, I'm a perfect example, that I survived. And I think it had everything to do with what I just mentioned to you. So that was the platform. From then on, it was a matter of understanding what's best out there, selecting the right clients. And when I say that, I think everyone is a client, for this type of treatment process. When you asked about, well, would you use stem cells and what kind of stem cells? We actually still use PRP. And that's, again, drawn from the blood, processed. You got mesenchymal stem cells, you got growth factors. And we seem to find, and it's very interesting, that the younger you are and the healthier you are, you can turn around almost as well as receiving the stem cells that's processed from umbilical cord. And so that says a lot, and that's very impactful, because there is a price tag, unfortunately, to all of the above. And the price tag with processed stem cells, where it goes into several $1,000s, I think $4,000 or $5,000, something like that.
Depends on what you're having.
Yeah, depends on the volume, depends on how many treatments you might need, and we'll talk about that in a little bit as well. But it's nice to know that we can still reach for PRP, which is a lot affordable, and quantitatively, we have 6-7 liters of blood in our body. So we've got the source, where we can obtain the blood, and we usually take like 20 cc's, 20 mLs, 30 mLs of blood, that'll give us plenty of PRP to inject. So that's the beauty of it as well also.
Yeah, we find we take care of pro fighters, pro boxers, and
a lot of amateurs as well.
Amateur MMA fighters, UFC fighters, and even some ex-football players, ex-baseball players, pretty well known around here. But the young kids that come in, the boxers, I mean, they leave here feeling it. It's like, I feel better already. So it's like the healing process, and they're good to go, because they just don't know when to. They don't have time to rest, and they can't sit still. And we recommend you allow the PRP or the stem cells to work, and because they gravitate towards inflammation. So if you're continuously causing inflammation and you're not resting, they have to work harder. So it works best if you can at least lay low for 2 to 4 weeks. We say 4 weeks, but have to do what you have to do.
And that's a good point, because sometimes you see a delay in response, and then we're like, well, what caused that? Why does someone get excellent results and someone maybe get a little delayed, although they will get the results? And that's, again, with everything else, if you don't follow our instructions of, kind of like trying to do less stressful stuff, if it's someone that got a knee injection with the PRP or stem cells, if they don't follow the instructions of, using heat, to help with some of the discomfort, or you have to take Tylenol as opposed to NSAIDs or like Motrin or Naproxen, because you do that, you sort of counteract, that inflammatory process that the stem cells need to sort out and be able to get rid of. So, and then the other important factor is the severity of your disease process. If you have mild to moderate, degenerative joint disease involving your knee or your shoulder, that's great. You're going to respond better than someone who's got moderate to severe. I mean, we've seen individuals with severe, almost bone on bone, type of joint disease. And we tell them right at the start, hey, look, you may need more than one treatment. It may take longer, 6 months maybe. And that's kind of like the end point for most of the injections. If your turnaround is not done pretty much by 6 months, well, most of them will feel better, but you may need a second injection. So I mean, it makes sense, right? I mean, if you come in with a pretty severe process, you're going to be more of a challenge as opposed to the person who's coming into us earlier with just mild to moderate disease process.
And you have to, you need to follow the instructions. Just like if you went in and had surgery and, you weren't supposed to do this, and that, and you did it, the surgery may not take as well as somebody who did. So you have to allow your body to heal. And stem cells and exosomes, they're all about healing and repairing. And they, like we said, they gravitate towards areas of inflammation, and then the repair process starts.
One more very important thing that just came to mind too. In the past, my background is emergency medicine, by the way, and prior to that, I was in the military as a physician as well. I was called a flight surgeon, so I took care of pilots and their family, and I did a full year of orthopedics during my military career. And so I learned a lot about breakdown, trauma, disease processes, and the use of like all these products. And back then it was steroids. Inject dexamethasone, inject or Aristocort, things that you're probably familiar with. Steroids. And although it did seem to help, looking back, most of those individuals, what happened towards the end? They had surgery. It was either, let's clean out your joint, let's repair the injury, let's do this and that. And although it's still an important aspect of health and taking care of that particular patient, we feel that prior to that, let's give the now stem cells its go at it. Let's see if that can take care of your illness and your injuries. And let's see if we can avoid, the surgical process. And sure enough, I haven't injected any of the steroids ever since I started using the PRP and the stem cells. There's no need for it. It's absolutely zero need for it. In fact, we see patients who see us have had one steroid injection after another, and it felt better for a while, but then I'm back to ground zero. Where it's painful, it's swollen, I can't do what I needed to do. And so we take them on. We take care of them. We give them what we're talking about, and we see them back, and they are improved, and they are healthier. Mm-hmm. So that speaks highly for what we're talking about and the end result of it, and we love it. We get great gratification out of it.
And is there a point though too where like a joint is just too far gone and too degenerated where it's like, okay, you should just get that hip or knee replacement?
I think
yes.
And the key thing in that particular aspect, because I had dealt with one client, is how much misalignment might be going on due to that degenerative disease process. In other words, if the knee has been so damaged, we're not just talking about the wear and tear of the cartilage tissue or the ligamentous tissue, but now the joint is misaligned. You got an angle deformity, and therefore the whole loading of that joint, is so abnormal. That is a case where I think something like a total knee replacement would be necessary. And you could try to put off that total knee surgery maybe for a little bit longer period of time by controlling some of the disease process with stem cells in that knee joint, but you're not going to correct that malalignment. You're not going to correct, that loading of that particular joint, such that it's gonna break through the healing process of the stem cells itself, and therefore going on to do a total knee replacement, because usually with that they also kind of fix the misalignment of that particular joint as well.
So when you go into cost, because it's again, some people feel that it may not be affordable, but you have to look at your job. What do you do for your job? How long are you going to be out? Do you have something called family leave at work? So, to recuperate from a knee replacement or shoulder, which is the worst surgery, you should never get your shoulder done unless, because that's the toughest surgery.
You can put it out. You can put it off as long as you can.
So if you look if you look at down the road, I mean, you're losing money. Even if you have FMLA, it's 80%. If you have, and how many weeks do you have off? So, and if you work for a private company or whatnot, I mean, think of it. It'll probably cost you more being out of work than just paying for stem cells that
and we're all aware of the complications of surgery as well.
Exactly.
Right? So, I mean, there's no guarantee. I don't think any surgeon is going to guarantee, after we do that knee or after we do that hip, guaranteed, no, you'll be fine. No. In fact, I hate to say it, but there are instances where we've all heard it. The wrong joint gets operated on, right? Mm-hmm. Or you were supposed to take the right kidney out, but you took the left kidney out, right? I mean, that still occurs, and that as often as it used to in the past, but it still unfortunately occurs. Mm-hmm. And there's a risk of the anesthesia for surgery. That in of itself is a huge risk. Mm-hmm. Infections from the surgery. So when we talk about surgery, God bless the surgeons that are out there. Absolutely. We love them. But, if you go their route and we think if you don't give maybe the stem cells it's due, the whole surgical process comes with its own inherent risks. So,
and so why aren't more people using stem cells yet as common practice?
Because, one of the reasons is because we have to be careful. We really shouldn't even be saying stem cells. We're supposed to say umbilical cord products.
Anti-inflammatory.
So yes. And most people don't know that it's available in the US because most of us professionals that do this, utilize stem cells, stay under the radar. Most of our clients or patients are word of mouth. Mm-hmm. Or, I didn't know you did that. And that's how they find us. We do have it on our website as, umbilical cord products or human tissue products. Yeah. And people are like, what's that? But so at least it gives them an idea. I was like, wait a minute, let me Google that. And then it brings them to stem cells. Now, if you were in Florida and you were in other states, you could say stem cells. So hopefully RFK can change that.
Why can't we say the S word?
Because it works, and I think Big Pharma is watching us.
I think it has a lot to do with regulation, and it has to do with has there been enough studies in the U.S. to prove it's a worthy product, and so.
Meanwhile, it's been in every other country for how many years?
Right, and that's why people were going out of country, to get the treatments, and a lot of those places, were very. Worthy and did turn around
very expensive,
a good number of clients, but then again, there are again, some places that weren't, and on top of that, you got to fly there and you got to stay there, and then once you fly back, as far as having any further doctor or nurse practitioner, the patient still relationship going on, it's gone. I mean, I doubt it if any of the centers that were out of country, would provide the type of follow-up that we would, with the patients that come to see us. And that's an important aspect of all of this as well, too.
Right. We do some other surgical procedures like body contouring or liposuction.
Well, it's minimally invasive.
Minimal invasive.
It's not really
so,
surgical. Minimally invasive.
But, we have a lot of people that come here who had gone to other countries to get this procedure done, just to save a couple bucks, and they usually come back a mess. And it's like, I'm sorry, we can't, we didn't do this. You're going to have to go to the emergency room or have a plastic surgeon or whatnot, because
there's a lot of complications.
There's a lot of complications that can happen if you're in another country. Let's put it that way.
It's always a risk benefit.
You just don't know.
Risk benefit that you have to look at.
Right.
But I think it's definitely becoming more and more popular. The podcasting, like yourself, other podcasters, Joe Rogan. I mean, he talks about this excessively. Dana White himself, talks about the alternative practice and being off of medications and pursuing a different alternative route and feeling healthier. And there are other things that we're going to implement as well. I don't know if you have time. There's a product that we're going to start looking into, and it's from the cannabis plant.
Actually, we have it.
And we have the product. It's been looked at. It's been studied at the university levels here in this country. And what this processed product is the CBD product of cannabis. The cannabinoid. Exactly. Excuse me. Right. Not the THC, not the tetrahydrocannabinoid, but the CBD, which is purely the whole medicinal aspect, of that cannabis plant. And we have, as it discovered in our bodies, cannabinoid-like receptors. And once stimulated, they help in things like pain and inflammation. And in this particular case, it's been studied for anxiety, sleep disorders. And as they've been doing these studies on that, they're discovering it's been helpful in pain management. It's been helpful in inflammatory conditions. And again, it would be fantastic, to keep studying, its usefulness, because I think, again, the sky's the limit with regards to this.
Yeah, they're doing.
It's fantastic.
They're doing more studies. Alzheimer's is one up there, because what is Alzheimer's? Inflammation, right? I mean, it really comes down to lack of B vitamins, genetically, what you're predisposed, stress, of course. But this, when you're not sleeping and you're anxious, then your whole cortisol system is out of whack. So, and then a lot of your issues start from that. This is, it's just an IV, takes about half hour. And we basically start at a certain dose that's recommended, and then we work up to what's going to work for you. And the unique thing about this is, and this was explained because we asked this, if somebody who's a law enforcement or a CDL driver, that is tested. Will this show up in your bloodstream? Because some over-the-counter,
THC, right.
So some of the over-the-counter CBD products, even though they're wonderful and they say there's no trace, when anything goes through the digestive tract, it's not. It can convert. For instance, they found that some products that have stated that, even though it did not contain any THC, it showed up in the urine of a drug test because of the way it was metabolized in the digestive tract. So doing it the IV route, there's none. So that's always good for people who, being a cop is stressful, especially now, the last 10 years, I would say. So, it can help quite a few people. You can get them off of the sleeping medication. And they say they can last up to 6 weeks just by one treatment once you get the right dose. So if you come in once every 6 weeks to get something that's going to change your life and improve everything,
And it may
Absolutely.
it may expand longer, as you're
Right.
correcting the disease process instead of like say every 6 weeks, maybe you could go out every 10 weeks, 12
Correct.
weeks, 6 months. I mean, it's something that, once we heard about it, we said, this is going to be fantastic.
Yeah,
Let's get
it's
involved
called
with it.
PICO IV,
Yeah.
PICOIV. Look it up. The benefits are amazing. They're even studying it for getting rid of fungi, bacteria in your system, and they're actually doing a study right now for MRSA and certain types of gram-negative bacteria. So this is infections within your body. So we think about Lyme disease, for instance. I mean, all kind of co-infections in there.
A natural product from a natural plant.
Yes.
That we know the history of what that was all about.
Right.
Years and years ago, where it was criminalized. So
right, and then so our practice again, we focus on anything that we can do to help your body heal itself naturally. And if we have to bring in some type of medication for some reason, there's a reason. Obviously, if you came in here, we knew you had strep throat for some reason, you can, can you check my throat, whatever. Of course, we're going to treat you with an antibiotic, but we'll also make sure you take your probiotics and digestive enzymes so you don't end up with other issues. So it's a balance. Eastern and Western medicine, mostly Eastern we try to do, our focus is on, but the two go together. It's like yin and yang.
She works on
so we have
meridians and the chakras.
Yeah, so we have this device from Germany. In every other country but the U.S., it's called bioresonance therapy that works in electromagnetic energy and kinesiology.
The headphones that we did?
Yes.
Yes,
That's
the headphones. Now we have a newer upgrade that the software has been upgraded, and this is amazing because even through the headphones, when you're done with that, I can harmonize your body that has been stressed. So this has been since 1970, I believe, in Germany, and it started out for animals. Animals had stomach issues, their paws, their ears, their eyes, the typical things that dogs can get. And dogs were getting better, so the owners were, they wanted it too. So they said, can I try it on me? So the veterinarians were doing it on the humans. We're close with the dogs and humans are not far apart in our bone structure and everything. And humans were getting better. So they continued the study. And then we worked with this physician actually from Greece who worked for this company. It's called Bicom in Germany. And she developed Thera Wellness. And this is the treatment plan, treatment device that I'll treat you with depending on what your body shows. We check the chakras. People know what chakras are. Meridians. If you've seen an acupuncturist, you'll hear about meridians. And then the device, when you're scanned, it will identify the imbalances and the disease cells in your body. When we have blood work done, you go to your doctor's office and you have a blood panel done. Oh, you're normal. Everything's normal. Yeah, but I don't feel good. Well, this device will identify things that are happening in your body before they actually show up. So if anything abnormal shows up in your blood, that means it's been going on for a while. It didn't just happen unless you have, an acute infection. So, for instance, if you have low testosterone, if you're coming in because you're not feeling good as a man or a woman, and that's low, that just didn't happen. You've been feeling this coming on for maybe a couple of years or even longer or, more than 6 months anyways. So it's very unique. And right now I'm taking care of a woman with ALS, and she was referred to us. And I've already identified what probably caused her ALS because she was healthy to begin with, no past medical history of anything. And the only thing she did was have the COVID vaccine. And shortly after, about a year after, she couldn't move her leg. And, they thought she had multiple sclerosis. And she went to a neurologist, and they did minimal testing because they knew in their mind she had ALS, and that's what they gave her the diagnosis of. So this woman's doing everything. She lives in Vermont, so she's not close by. And she saw a naturopath who changed her whole diet, and she's on certain supplements. And then she finally came here and we did the scan. They told her she had Lyme disease and mold, which also showed up, but the Lyme was only a couple co-infections. But severe mold, heavy metal, and she's working on some supplements and things to detox that part. But I cleaned it. Coronavirus is what showed up. And then I checked her with I have vials that have the Moderna and the Pfizer, and those are all charged with the energy of the vaccine, which I can actually neutralize and get it out of your system over time. So she's already feeling better. Not 100. It's going to be a journey for her. And one of the unique things with this device is I can do it remote. She's going to be going to Naples, and I'll be treating her on Friday remotely through DNA and her photo. It's amazing. I mean, it works. We've had people. We have a good friend.
You got to be a believer.
We have a good friend that I'll let Dr. Belanis talk about, who had sarcoidosis.
Well, if we have time, I mean, if you have other questions or so forth, I know we can go on and on.
Well, he used his device. He didn't believe in any. He was like, I don't believe this. Okay. And I only took him on because
quite frankly, I at the beginning I was a little bit somewhat skeptical about it, but you know, as you learn the science behind it and started to make sense. I mean, the device looks at like she said, the electromagnetic field of your cell, and if you're capable of identifying what's normal versus abnormal, then you have a platform of wavelengths to correct what's abnormal. I mean, it doesn't sound far-fetched when you explain it that way, because the technology out there, you know, is around that can do that. And so here you are, you find, all right, this wavelength, this electromagnetic field is abnormal. What can we now do, you know, to get that pattern, that wavelength, that field back to a normal? Right. It's like almost in a sense, what can we do to recharge that battery? You know, and the technology is there. It looks at everything on a cellular level. So just like when Christina was saying, you can utilize a bunch of blood tests to try and get at the problem, but sometimes it doesn't. And then you look at imaging studies. Oh, let's get everyone craves about, we need a total body MRI. A total body MRI will definitely make me feel comfortable if I don't see anything structural, you know, that's abnormal. But that in itself can be misleading, because structural, right? So first you have to have a functional abnormality. You have to have something at that smaller cellular level. Then once that becomes abnormal, diseased, then what happens? Then it'll go down the pathway of it being structurally abnormal. How long is that period going to be? Who knows? It could be months, it could be years. So by the time it develops into that structural framework of being abnormal, where an MRI can pick it up or a CAT scan, you're already behind the curve, right? You're all that period of time behind the curve, where if you have something that can look at it before it becomes structurally abnormal, and you can get to it at its cellular level, do it and get it at its cellular level.
Right. Well,
it makes sense.
Yeah, the way I explain it is, everybody, I'm not saying everybody, but I'm sure people have experienced some type of anxiety in their life, right? Whether it be going to school or going on a date or whatever it is, you know. So that's energy that's emitted. Okay. So it's, and this is what this identifies. Energy. Is it bad energy? Is it good energy? It's wavelength. So if you think about Reiki and all that, what do? If you have anxiety, you go see somebody with Reiki, who's a Reiki master. They're going to calm you down. That's just energy. It's touch. We're all made out of energy. Every particle in this world, down to an amoeba, has an energy they emit. So this just identifies the imbalances. It should be balanced, and if it's imbalanced in one way or another, this can correct it. Just balance. It's all balance in life.
Mhm.
So the scan will also identify foods you shouldn't be eating because if you eat them, they're not, you can feel good. And also foods that you can eat, it's not etched in stone because as your body heals, and it's usually the gut, the biome that we talk about, usually that's off for for whatever reason.
And so I've done the headphone, so it's
Yep.
measuring the electromagnetic fields we have.
Yep.
Correct.
Mhm.
How are you treating those things?
That's when, so that's the scan. And then we have the device that I use is called TheraWellness.
Mhm.
And they have applicators that you put across your belly. If it's a stomach issue, if it's parasite, could be respiratory, could be your chest,
in the head,
anxiety, could be around your head, headaches. So the device will tell me what I need to do. I test you kinesiology wise to find out, and I ask your body questions. So, right? So it's like, do you need this treatment? It will tell me if you need this treatment or not. If you don't need it, then I go to the next one. But the scan will give us prioritizes and identifies the priorities that need to be treated right now and right now.
Mhm.
So you could have, I've rescanned people and they have come in with a cold, maybe just had the flu. Well, of course, that's going to show up because that's a priority. We want to get rid of that. So we'll focus on that. Once that's gone, and we scan you to see where we're at. Does that make sense?
I mean, another kind of example I just recall now is me. Like I got past getting killed by the COVID illness and infection, but I was still far from being normal. After that whole ravaged disease process, so I went into this TheraWellness, and she's the master at it, and she treats. And to this very day, I still get treated with the TheraWellness. I mean, people think, all right, once we're done, then that's it, right? I'm cured. And it's like, no, dude, you're going to age, right? You're going to sometimes go back to your bad habits, maybe. Mm-hmm. I mean, and so therefore, you're going to be needing to get maintenance treatments. And they were like, oh, maintenance treatments. Oh, well, I thought I'd be cured. And it's like, how can you cure a process, where as time goes on, it's an aging process. There's things that, we're still being inundated with, whether it's in the environment, something toxic, and whether it's in the foods as preservatives, and things like that. If you can isolate yourself and keep yourself in some type of a bubble or island, I guess, somewhere where you're not inundated with all of these factors, then maybe one and done, and the rest of your life, you can age gracefully and without any disease process.
Right, yeah. But, you can go on a trip to Mexico, whatever, and eat, drink the water, and now you've got a whole different. So it's just, if you're feeling good, you're feeling good. If you have an issue, that's why you come, and we get you to feeling the best that you can, and your body can deal with it better. Yeah. And we get you on the right vitamins. Maybe you needed B vitamins, or you needed, peptides, or BPC 157, for instance, which is so good for healing the gut and just healing the whole body. So we get you feeling as healthy, help you change your lifestyle. If your lifestyle wasn't good, your body won't be predisposed to more disease states. Mm-hmm. So there's also education along with treatment. So, and anyways, it's wonderful.
Very exciting.
Wonderful. Yeah. Besides that, we do bioidentical hormones, female, male, female, because that's important too. As we age, we lose hormones, we lose human growth hormones, as well as the testosterone, for women, estrogen, progesterone, and it's all a balance. So anything in life is a balance. It's like, I know in your profession, if somebody over exercises and is in the gym 6 hours a day, what are they going to do? Oxidative stress is oxidative stress, right? Mm-hmm. Whether it's from eating McDonald's or, smoking, drinking, or over exercising, your body's going to create that. So too much of something isn't necessarily good either. It's a balance. And that's what we do. And that's why we also have, we try to limit what anything process going into your system. Like, for instance, we have this laser that builds collagen for anybody who is looking to get rid of wrinkles, to grow collagen as they age, opposed to throwing fillers and Botox and all that stuff into your body. Does that make sense? And so we offer that to people because people are looking for that. And this laser also has a device called biophotomodulation for pain, which will go down to the cellular level. I think we showed you that, did we not? Last time you were here?
I've looked into getting a grade 4, class 4 laser for the clinic.
Yeah.
There's some interesting data on it. We went another route with shockwave.
Yeah, but lasers are amazing on what they do. You get the right laser. So we try to offer as much as we can, but women, even men, they want the Botox, and there's nothing wrong with that. It's monitored. It's safe in small doses, and it's nothing. There's nothing wrong with feeling good and then wanting to look good too.
Yeah, well, I'm curious about that because like all these fillers and Botox, like Botox in and of itself, tox stands for toxin.
Right. Right.
So
it's the Clostridium toxin. You're absolutely right. So it's the lockjaw that
is
right.
Is this stuff healthy for people?
I think there's some people who, I remember years ago, I used to work with this physician and she did stem cells back 15 years ago. And she had this woman who was her patient, and this woman was a nurse, and she injected, a lot of Botox. That was her specialty, but she kept injecting herself and she wasn't feeling well. Anytime she saw a little, thought she saw a little wrinkle, she'd put Botox. This woman was so toxic from injecting herself that, she had joint pain, and then doing all the tests, this is what we found that was her issue, and she had to back away. Mm-hmm. So everybody's different. Depending on how you metabolize things, if you have a congestion in your liver, that's why we offer things to detox like glutathione, NAD, all that stuff. So it depends on how you eat and how somebody's going to react. And then with the Botox too, you can build up a resistance. So sometimes it doesn't work, and then you continue giving more and more and more. And, we don't know down the road, because now you're younger. The kids, the girls are getting it at such a younger age. As soon as they turn 18, they're getting Botox. I'm like, do you need Botox? Opposed to, starting in your 40s. Yeah,
thinking of it as being preventative. Yeah, I want to get ahead of the game. Let's get the Botox before.
Right.
Again, before the wrinkles start to show
too much
up.
Is not. Is not
I
enough.
agree. I think there's going to be everything's in moderation, right? So I think that's going to be
down the road
where they all of a sudden something does occur from it. So far, it has not. So. I think that speaks, and Botox has been around for decades now. Right.
But we have this laser that does something called endotite, where we take this hot fiber, we obviously put a little lidocaine so it doesn't hurt, we put it underneath your skin and lift and tighten. So we do that instead of
natural. It's a natural way.
We also, for the lips, there's a procedure called lip lace, where we actually grow your own collagen on your lips. So many treatments can last up to 5 years. Why not have your lips naturally grow collagen? We can shape them the same way. And this is laser, and it's safe. You just have to wear goggles and close your eyes. That's it. It's not causing anything. It's in that area, and it's just stimulating your own collagen production. So I'm just saying there's so many alternatives out there. Why not use those? Then just jump to it.
I can see you're ready to sign up for it. You got that look. Sign me up.
No. Yeah. It was. Can the collagen be misformed or misshapen or something though? Because I've seen a lot of girls. A lot of girls that are getting these fillers and stuff and things.
No, they're just getting too much.
Yeah.
No, the fillers are hyaluronic acid.
Yeah.
So that's naturally found in our system, but it's when it's made by the the filler companies and all that stuff, It's just a thicker solution that it doesn't build collagen. That's just product.
Yeah.
So hyaluronic acid will not build it. The only thing that will build collagen are certain, there's some biostimulants, but you don't put it in the lips. But yeah, there's a lot of things out there. But for instance, I think Ariana Grande, there was an article at one point a couple of years ago where she used to get all these fillers. Now she's talking against fillers, and she was talked into it, and she feels better with her natural lips. So depends on your culture, depends on, certain cultures like everything big, except the waist. You know what I mean?
Yeah.
So
I think that about wraps things up. There's definitely more we could have you guys come on to talk about, but we can kind of wrap up there for today. So where can people find you if they want to learn more about your practice and your offerings?
Okay, so we're Dynamic Evolutions in Health and Beauty because we do everything inside out. We are located at 101 Access Road, Suite 1B, and that's in Norwood, Massachusetts. We're right in where the Memorial Airport is. Plenty of parking, very easy to get to. Our website's dynamicevolutions.com, and you can always give us a call. We're on Instagram, we're on Facebook, YouTube, we're on the channels, and our office number is 617-866-2500. So feel free to look us up. I mean, we love what we do. We know it works. We'll never stop doing it. And we want to share.
So it's an active airport. So for those of you who own your own little aircraft or a single engine jet, buzz right in, buzz right out. You're like, can't be any easier than that.
There you go.
All good stuff. All good stuff.
All right. Well, thank you guys so much for coming.
Thank you, Brett. We appreciate you having us on.
It was a delight. It was a pleasure. We love providing information and all these great stories. I think the fact that we've outgrown our first office and now we already outgrow this office speaks highly, of the things that have been done.
Right. One thing I didn't mention, we have this. We also have an esthetician here that is a master of just facials,
skin,
just natural products
hair,
using mud wraps. We have a sauna here, an infrared sauna, and a shower. So if you want to come in and have a whole body scrub, it feels good. You can detox. It's just amazing. So we have as much as we can, and we're looking into getting a hyperbaric chamber down the road.
Oxygen chamber.
Oxygen chamber. We're talking about one of the medical grade ones, not the little ones. These are module ones, and we can decompress you. It's like going below sea level. I mean, it's pretty intense. So you talk about healing power.
Yeah. Well, very good. Thanks
all right,
again.
Brett. Well, thank you so much. Have a great day.
You too.
Appreciate it.
All right. Bye-bye.
Bye-bye now.
84% of you that listen to this podcast frequently do not hit the follow button. If you've enjoyed any of these episodes, could you do us a favor and hit the follow button, leave a rating, and maybe leave us a review? It helps this channel more than you know, and the bigger the channel gets, the bigger the guests get. If you'd like to know more about training in person or online with Brett's Gym, Architect Fitness, please follow us on social at ARKITECT Fitness on Instagram or visit ARKITECTFitness.com. Or if you want to rehab with Barbell Therapy online or in person, check out @barbell.therapy or visit barbelltherapyandperformance.com. Thank you for taking the time to listen.